With frequency specific microcurrent, you literally have a pad on the back of your neck and a pad on your lower abdomen. You don't feel anything, but what it's doing is
it is modulating whatever you have asked it to modulate. They actually tested this frequency, and 40 was the only frequency coupled with other frequencies for the immune system in the skin that actually dropped inflammation in 4 minutes between 60 and 70% in 4 minutes.
All right. Welcome back, everyone, to our video podcast at Holistic Health Associates, which is about collaborating with high quality healthcare practitioners. And today is another very exciting one. I can't tell you how excited I am actually to have Shannon Gozon on the podcast with me today. Shannon is an acupuncture physician. She is a licensed massage therapist, and she is a certified myofascial trigger point therapist. She runs multiple companies and practices and is just one of the greatest practitioners that I have seen in action with all these different modalities that she mixes and matches. And she's one of the 2 or 3 people in the world that come up with algorithms and programs for the frequency specific microcurrent, our nerve reboot program that we will be that we're piloting right now at Holistic Health Associates and are planning to bring in as a service in the near future. And so we're going to mainly talk about that today and all of the different, what it is, what the benefits are, why you should consider this as a important part of an addition to your service plan. But anyway, I'm going to stop going on and on. Shannon, it is just great to have you here with me. So thank you so much for being here.
Ryan, you are welcome, and it's a delight to be here. You were just so much fun in the class that we had in February in Austin, and it was just so terrific to meet you and your colleagues and interact with everybody and have all of us collectively just go into this deep dive of the body and energy and how we can really think about the nervous system and just changing how we reboot that nervous system. So I'm delighted to be here today. Thank you.
Fantastic. Yes, Shannon was my teacher of this program, and that is absolutely, a teacher is what she naturally does. So great. So thanks again. Fantastic. Well, let's talk about frequency specific microcurrent and nerve reboot, because that's really the thing that people have some questions about. And we just have seen it in action and are so excited about it. So I just want that to translate to people. Tell us a little bit just about how you got involved with it, and just, how did this end up on your massage therapy, trigger point, acupuncture plate?
Oh my goodness. Thank you so much for asking that question. Wow, what a journey, as we all have had a journey on this place that I call Playground Earth, where things happen. People get their knees skinned in the playground and other crazy things happen. I was very, very fortunate that I have always just somehow ended at the very top of the heap with my mentors and everything that I have learned. And with frequency specific microcurrent very, very early into my career, as a licensed massage therapist, and I will just disclose that I went to school to get a license to touch. I was already doing my postgraduate training in myofascial trigger point therapy, had already had interactions with Dr. Janet Travell, who was John F. Kennedy's physician in the White House while she was still alive. And I was very clear that I was going down this myofascial trigger point therapy pathway. And in Florida, I had to have a license to touch. And the other thing that we do with myofascial trigger point therapy is something called perpetuating factors. And those are all the things that all of us are treating that are happening in the person's life and around them with work, with home, with stressors, with diet, with exercise, you name it. And so in order to really treat myofascial pain well, you had to be able to address perpetuating factors. Well, it turns out in Florida, being an acupuncture physician is pretty close to primary care, which allowed me to address all perpetuating factors. So the reason that I tell you this is because I put myself in school so I could dry needle trigger points and stick needles in trigger points. And I had already been needling under a physician who was a trainer for acupuncture and did integrative medicine, Dr. Shirley Hartman. And while I was in my training, my first year, Dr. Hartman had gone through some training through someone that had presented, Dr. Carolyn McMakin at IFM. So this is 23 years ago that this, maybe 24, that this happened. And Dr. Hartman came back and said, oh my gosh, Shannon, we have to do this. And I'm like, I'm all in. Treating with frequencies, that sounds like another way to deal with the nervous system and treat perpetuating factors. Count me in. And so we hosted the training for frequency-specific microcurrent. Carolyn McMakin came into Jacksonville. We became very, very fast friends. And I saw an immediate application for using this. And let me tell you, Ryan, when I learned how to do frequency-specific microcurrent, I learned the frequencies on a whiteboard. Wow. I actually even have a plaque that says I got a whiteboard award when you really, really had to want it. And so I dove into all of this wholeheartedly and then just started in on that vertical learning curve where we really did not even begin to have the mileage that we do right now. But I was surrounded by amazing physicians that were doing frequency-specific microcurrent. And because of the practices that I was already in while I was in school, all the cases were so challenging and so difficult. So we were able to see, like, okay, this is the patient was their own control before we started doing this modality. And then we saw what happened after. So this is one of the things you can see this kind of like, oh, this was happening in my treatment plan. And now we added this. And now this is what's changed. So I got in, I'm just going to say I kind of got in on the ground floor when using dual frequencies, frequency-specific microcurrent was kind of brought back into vogue and reintroduced. And we had equipment to do it, although the equipment is giant. I'm sitting in a room right now where I've got 3 of these giant blue boxes, is what we call it, these analog machines. And so that is where I started. And then now we've moved into the 21st century. Everybody that is watching this right now, oh my gosh, you have landed in this in the exact right time, because the equipment, which Ryan will tell you, is incredibly user-friendly now. You can put it in your pocket, you can put it in a fanny sack, you can carry it with you. And it's very, very easy to operate, and we can take it with us everywhere. And we are just in the 21st century with this now, and it's so easy to use and changes lives. So we're moving into me having done this for nearly a quarter of a century. So that's how I got into it.
It's amazing because, I mean, it's an amazing story. And the people that you mentioned are the people that are really driving this thing forward. And the fact that it's been around for 25 years, but none of us heard of it. I mean, I didn't hear about it in this field. A lot of my practitioners had never heard of it when I showed them this. And the fact that it started with Kennedy and, like it's literally that old that it was, but then it kind of came back in vogue, it sounds like, in a different format with different, technology. Why did it come back in vogue?
This is one of the things that we talked about early on is so microcurrent, using microcurrent and using MENS, which is what we called it. This is where that big blue box comes from in the original form of it. It's been around since the 70s. And Janet Travell, one of my dear colleagues, sent me a letter that he had gotten where Janet Travell talked about microcurrent being the modality of the future in one of these letters. I have it on one of my old computers. And she just understood that electricity and using microcurrent, okay, which is much, much closer to how our nervous system works, was a way to actually give the cells the energy that they needed to do their job and repair. Now, the challenge that we had was that when it was being used in chiropractic offices and physical therapists, which, I mean, that was the thing with athletes then to go ahead and do it, people couldn't feel it. This is also what's in our favor right now. Also, it's subsensory. So you don't know that anything is happening. And people were like, well, you're not really doing anything, are you? Because they couldn't feel it.
Right.
So they were used to like Russian stem and different types of E-stem and galvanic stimulation, where they could actually feel their muscles jumping and something happening, which, by the way, like TENS is counterproductive because it's using up energy rather than creating it from a standpoint of healing. So it just went out of vogue because people couldn't feel it and whatever. And I don't think we had enough information maybe. And then as it's come back as 2-channel, where we are with the frequencies that we have treating an issue in a tissue. And then now with all of the new equipment, it's just so easy to string all of these frequencies together so you can treat multiple issues in multiple tissues. And then now with, like what I've done for all of you, it's just press and go. I've made it super, super easy for people because, like I said, I've got nearly a quarter of a century, plus I've been standing on the shoulders of giants since I've been a practitioner. So it's easy. And now, for whatever reason, maybe it's because we're so finely finessed with this that the changes are instantaneous. So you can't argue with the results because it happens right now with so many things we do. And people are like, oh my gosh, what was that? What just happened to me? And so they are, I think, in the world of cell phones where you don't need wires connected to a phone to talk to people, and we understand quantum physics, and we understand that things don't have to be touching in order to have an effect. We're more believing that, you can put something on me that I don't feel and something could happen.
Right. So just for those of the people that this is all foreign language to, as we're starting off here and kind of jumping right into the deep end of the pool, what we're talking about is electrostimulation, but it's electrostimulation that you don't feel. So those patients of ours who have gotten electrostimulation on with little clips that go onto the acupuncture needles, they feel that. We turn it up until they feel it. This is electrostimulation, but you don't feel it. And the specific part of it is, I'm going to let Shannon go into the detail on, because that's the differentiating factor. That's the piece that makes this so exciting for me, is that normally what we do is we put the needles in, we turn the stimulation on, you feel a little jolting or a little electricity going through your knee, but there's no real specificity to it. It's just agitating the point enough to get that point to stay stimulated. But with frequency-specific microcurrent, you literally have a pad on the back of your neck and a pad on your lower abdomen. You don't feel anything, but what it's doing is
it is modulating whatever you have asked it to modulate. And so there are very specific frequencies for things like inflammation. And now I'm sure all of your listeners know that inflammation that is counterproductive, that is not pro-inflammatory, meaning helping us, inflammation that is there because of something that happened, being under tremendous stresses, eating the bad food, exposed to something, that inflammation actually injures our tissues and is counterproductive and leads to a lot of potential disease. Well, guess what? We have a frequency for inflammation. And when the researcher in Australia, Dr. Vivian Reeve, who actually tests at the time all anti-inflammatory drugs, modalities, anything, they all went through her laboratory. So it was a laboratory with animals, critters that were very well taken care of, but they were actually perfectly set up to do all of the research. They actually tested this frequency, and 40 was the only frequency, coupled with other frequencies for the immune system in the skin, that actually dropped inflammation in 4 minutes between 60 and 70% in 4 minutes. That's like, you can't do that with Toradol. That's like medically impossible. And it freaked her out because she'd never seen it. So she like cleared everything out and she blinded everybody and no one knew what was happening. And it still worked in 4 minutes, but it had to be that frequency 40. Mm-hmm. And clinically, this is what we see happen, that we actually change inflammation when we use that particular frequency. So that is a frequency for a condition or an issue, as I call it. That's an issue. And then you have another frequency on another channel, and these both run together at the same time when you press start. That's why Ryan said you have one electrode that's on the back of your neck and one on your abdomen. But sometimes we put it, like if you hurt your arm, we'll put it through your arm. If you hurt your leg. So all this information is given to people when they're using the device, or your practitioner knows exactly what to do. But when we want to target it with a specific tissue, okay, or your target tissue, so to speak of, then that frequency goes on channel 2. So the one that was probably the most eye-popping for all of us was when Dr. McMakin was invited to grand rounds at NIH in 2000. And she presented these cases where people had fibromyalgia, and she was taking their pain from anywhere from a 7, 8, 9, 10 down to a 0, 1, 2. And they were getting better. And those were in the days, that was in the 90s when we were all told in my world that there was no cure for fibromyalgia, which did not seem right, because it didn't seem like it was like a benzodiazepine deficiency disorder and all the crazy stuff that people were doing. Didn't make sense. Well, we were able to couple that frequency 40 with the spinal cord and bring down inflammation in the spinal cord. So think about your nervous system. And all of a sudden, people were just having these logarithmic drops in pain by a factor of 10 in under 90 minutes. And so it was an NIH researcher that actually evaluated the blood samples and said, yeah, the inflammatory cytokines are going down in every single one of these patients. And so this was an independent researcher that had done this. And it was like, okay, we've got a lot of people saying, yep, when you run frequencies for tissues that have problems with 40, it seems to consistently bring down inflammation. And then that is what we see clinically. So the basics of it is you're thinking about, what's my issue and in what tissue am I having the problem? And then we have protocols that are put together that specifically target that type of problem.
Right, exactly. That's fantastic. So for example, the units that we have in our office have 200 protocols, because you were kind enough to share those protocols with us. And so when you come into our office, we can choose. We'll go through some of the nerve reboot at first and make sure that your nervous system gets primed for this. And then if you have a specific condition or an issue in a tissue, as you said, then we can find which one of those 200 protocols matches inflammation in the cervical spine, inflammation in the lower back, inflammation in the hip. And we can actually target those areas with 2 frequencies, one, as you said, that goes to the inflammation, and one that goes to the hip or wherever we're going. Is that accurate?
Yeah. And then the beautiful thing about the soup that goes with this. And so this is what practitioners that are very, very curious and really thinking about, gosh, what's really going on here? Why haven't I been able to solve this problem? This is why practitioners get so excited about this and being able to treat their patients, because everything, Ryan, everything that you and I were taught in school, and I've been through a lot of schooling in many different ways. And then also I became a spine specialist and I did North American Spine Society and I could go on and on all these different things. And what really happens is I'm going to just say boldly that we're brainwashed, that it's like, oh, blah, 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 but don't worry about that because there's nothing you can do about it. So then what you're going to do is treat this muscle, stretch this muscle, treat this trigger point, put this needle in here, do this 4-needle technique, do this, do that. Here's the recipe. And we're going to treat the symptom, right?
Mm-hmm.
So very, very rarely does anybody in our schooling say, okay, we're going to go right to the cause. Acupuncture for me was the closest, right? Because they were looking at what is the underlying issue with the organ, and the history of this person that's leading to this. I did 5-element acupuncture. J.R. Worsley and Judy, they were instructors for me and mentors as well. And while J.R. was still with us, and at least the 5-element was thinking, what's the causative factor going back to the very beginning? But still, it wasn't really going to the thing behind the thing behind the thing, because all of us were told that we really can't do anything about the nervous system. And I do that in a very long-winded way, because, Jimmy talked about it when he was first in my training with me. Gosh, I think it's more than 2 years ago now. He's like, oh my God, we're just like rebooting the nervous system. This is like a total nerve reboot. And that's because I tell everybody, everything that happens to you is controlled by your central nervous system, which is your brain and your spinal cord. And then from that, you have nerve roots that go out to individual nerves that go to the muscle. And Sherrington's law was, the final pathway is movement. Okay. And so when people are having problems with that movement, I'm here to tell you it's the central nervous system. And guess what? Frequency specific microcurrent, in my opinion, does better than anything else I've seen. Treat the nervous system. Mm-hmm. Mm-hmm. And I'm in a spinal surgical practice, orthopedics and neurology. I can tell you when people have necessarily and very quickly and urgently needed to have surgery, but it doesn't necessarily get rid of their pain because of the ongoing inflammation. We can run microcurrent after, if it didn't settle down, and just take pain that's a 9 out of 10 nerve pain and take it down to a 0, because we can put the fire out that's self-perpetuating. Now, once you've seen these protocols, it's like once you have inflammation, there's usually calcium deposits that show up because calcium is our natural anti-inflammatory. And when people have had bad things happen, now you can have some scarring and fibrosis, and then there may be an emotional component to it. So this is where, with the soup that we create of these protocols, we can think about what was the first thing that went wrong? Who's really, really got the wrong communication for healing happening? And then why isn't that working? And then what else went wrong when this thing went wrong? So now practitioners are like, oh my gosh, I can totally treat the brain. I can totally treat the spinal cord. I can totally treat the nerves now. So this is what practitioners and patients get so excited about. It's like, oh my gosh, someone's finally asking me the real questions about my history and what happened to me and how I got here today.
Amazing. Yeah, that is fantastic. And it so dovetails with acupuncture, as you know, because of that. You know what I mean? And that's what really attracted me to it. I felt like it was very complementary to acupuncture. I felt like, using your example of tissue, repairing the tissue and using the central nervous system as that kind of like bridge between the brain and the body to help the tissue to repair faster is very similar to the acupuncture theory. Acupuncture focuses on the peripheral nerves for the most part. And, FSM really focuses so much on the central nervous system. And yet there's just a lot of overlap. So whenever we hear about a new modality and it sounds great and everything, it's going to fix everything, right? So then why are there other modalities, right? Why, you yourself do 3 different modalities, you do trigger point therapy, and you use microcurrent. So why does someone get both? Why does someone get multiple services? Why is it beneficial? Just give me your opinion on that.
Gosh, I'm so glad you asked that question, because this goes back into what Janet Travell taught me from the beginning. the mystery is in the history. And Ryan, you have heard me say this. And the most important thing we can do with our clients is figure out that mystery in the history. And then when you get really good at asking questions, which I think acupuncture physicians, especially what I learned as a 5-element acupuncture practitioner on getting that causative factor, you do these really long intakes where you are getting into rapport with your patient. They are finally being seen and heard. And that in and of itself is healing as far as I'm concerned, because, oh my gosh, finally someone's listening. Within that, you'll get these gems like, the one thing that I did that really helped was this, or I don't do well with that, but I do well with this. Or if you could just take care of this one thing right now, I would totally believe everything you're saying. So when we listen to the patient, they actually direct us. And so like, when I teach, I might have said this in the class. I show up with a Mary Poppins bag, and in my Mary Poppins bag, I've got 4 different types of microcurrent, PEMF, types of subtle energy devices that do a little bit different things, and then of course I've got phenomenal manual therapy skills. And of course, you were in the class where you got to see my mover stabilizer technique, because I'm all about fixing stuff fast. And it's combining all of it and giving the body everything that it needs to get information, because the electricity in the form of microcurrent, which is very, very similar to our body's energy form, and giving the muscles information, removing interference so the body can do what it is programmed to do anyway. It allows them to have this very, very fast right now experience of like, oh my gosh, I'm different. What just happened? And now we can continue on with how we go into long-term, sustainable, permanent, how you take care of yourself for the rest of your life to maintain your results and live a vibrant, long life and not suffer. Mm-hmm. So that would be the best way I would describe it. And what I've done over the last 20 years, anything that worked well, anything that had like right now, I can tell something has happened and something is different, or I have by inspection, I can see the tissue changed immediately. I adopt it. I am a feet on the ground, just show me what works kind of girl. And if I get results, you've got my attention.
Right. So basically, if you have something that we know works for a lot of people, like acupuncture, like massage therapy, and then we also have FS, functional, frequency specific microcurrent, which also works for a lot of people. And now you combine the two, the chances of success go up by a degree of magnitude. Right.
Dramatically.
Yeah.
And I have a couple of people that are like, oh my gosh, I just love the way you do acupuncture and I just want acupuncture. Mm-hmm. That's fine. They're in it for, just maintaining. I have, some other people that athletes where it's like, nope, I'm good to go. I just need that mover stabilizer. I need to get this stabilizer muscle turned on and I need to do X, Y, and Z. Mm-hmm. And then I have other people that are just like, I want the deluxe car wash. I want it all. Yeah. And then I've got other people that at the end of a treatment, they're like, what do you think worked? And I'm like, it doesn't matter. It worked. Right. And so I am fortunately not the scientist in the dark closet that needs to have causative factor of just one intervention, because, oh, by the way, that's not how the body works anyway. Right. So I don't need to have that when I'm just trying to fix a big problem.
Yeah. I mean, it makes a lot of sense. We give the analogy in our office that, you can't just eat broccoli and, expect that you're going to get all the nutrients you want. As good as broccoli is for you, you still want carrots, you still want, cucumbers, and you still want this, you still want fruit, you have to get a variety of things, because then your body is getting messages that are all moving in the same, they're rowing the boat in the same way, but you're getting different groups of, different tools to help row that boat. You got a motor, you got some rowers, you got some different things that are helping to keep things moving forward in a really healthy way. So that's awesome.
Absolutely. And it's like you saw me use probes and you saw that I had an abasia and different. It's like I play the game. If I'm stranded on a desert island, and then everybody has a skin issue, I'm bringing my laser. If everybody has scars, I'm bringing my abasia. If everybody has fibromyalgia, I'm bringing my 2-channel FSM microcurrent unit. If everybody has all of those things and I can only take one device, I'm taking my MEN device, my 2-channel microcurrent device. So that's where this one device has been the most versatile for everything. And then there's certain things that I choose other devices for.
Yeah, fantastic. And people are going to ask us, how often do you have to do this? We get this question a lot. So how often do you have to do acupuncture? How often do you do massage? This is always a complicated question that we get, but I'm curious as to just what your response is when people say, hey, how often should I do frequency specific microcurrent?
So in the beginning, every visit, so that you have the time to get it in. So, and certainly Ryan, in your office, I mean, you've got the new super duper protocols that allow you to do really long protocols that we have in 30 minutes because you can use multiple devices. So we've got it really, I'm going to just use the term dialed in, where you can get a lot done in a little bit of time. But in the beginning, I suggest to people that they do it every visit. My rule for me, though, Ryan, is I expect to see something change within 3 appointments. I have a 3-appointment rule. At this point, the way my clinic is set up and when I'm working, I usually see something happen on the very, very first visit. We will have a pretty significant change, but I'm able to come in and do that differential diagnosis. And you've seen the ping pong ball go through my brain on how I put everything together. So I can usually dial it in. And oh, by the way, I can use 4 devices at a time. So I can be treating multiple layers of a problem at once. In the beginning, though, I'm going to suggest that all practitioners should be using FSM every single visit. Because remember, we're always going to start with that central nervous system to just make sure mission control, the brain, is working optimally. And then the information highway, which is the spinal cord, these are just names that I've given these structures so people have a vision of it, that information highway is completely clear for messages going into the brain and coming out of the brain to talk to the nerve roots, to talk to the muscles that move the joints and move us on the planet. So it just allows us to get all of that cleared up first. And then in the beginning, if we're dealing with something that is like, you got to take care of this right now, we can be clearing that up in the background while we're doing a program for the wrist, which has all of the frequencies for the joint, for the muscles, for the tendons, for the ligaments, the cartilage, all of it. This is where it's combined. But absolutely every visit, I would say for the first 2 weeks, and then just let that practitioner make notes on what has changed, pain levels, and then also behaviorally, and then things that have changed in the body. What typically happens, Ryan, is that someone will come back on visit 4 and they're like, I still have this thing right here. I don't know if this is working. And it's like, well, how's your neck pain? Well, what neck pain? What are you talking about? I don't have any. Well, it's like 2 weeks ago you had neck pain. I did? I forgot. And that is the sign of a healthy nervous system. When your patients forget how much pain they had or where they had pain, that is like music to my ears, because we are designed to just like get over what happened and move forward, not living in the past. It's not, oh my gosh, I hope that terrible pain that I had 3 months ago, I hope it doesn't come back.
Yeah.
So I love it when patients forget. It's a very good sign for me. So this is where you just chart it. I try not to remind them. I just do a pain map every time people come in, and I just let them tell me where they have pain. Where have you had pain this week, or where do you have pain today? And then I just see how that pain map changes.
Fantastic. So cool. And it is amazing. You said like three sessions and how quickly some of this can work. I mean, I personally experienced it over 3 days of doing. I used it for 3 days on the same thing. You know, I had some tissue damage between my abdominal muscles, and it was a completely different experience 3 days later. I mean, you saw it. Everybody in the class saw it, you
It's
know?
great.
It was
You were great evidence for everybody in the class. It was like, oh, I don't know if I believe your pictures on the screen. And then there you were in the flesh, literally, with it changed.
There was only, what were there, maybe 20 people in the class,
Yeah.
and there was another, gentleman in the class who's a physical therapist who came in on crutches and walked out without them. That was 3 days.
Correct.
So in 3 days, you don't give up crutches. So, they're using it all day. And, in those situations, not everyone's going to use it all day, but it's a good indication of how much it's doing without any real sensation, how much it's actually affecting the body.
Exactly. And then we just give the information to the muscles so that stabilizer muscles turn back on and mover muscles can do their job. And then those muscles are like, oh, that thing that was a problem, it's gone. I can do this now. And that's the power of having the microcurrent in the back. And of course, you have all of that skill set now to be able to do that mover stabilizer.
Oh, yeah.
And then, so Ryan, I'm going to ask you a question. I'm going to interview you now. Ryan, can you tell everybody what happened the second morning when you went out for your morning workout?
So the second day I went out for a run the morning of the workshop. Usually you're like fatigued at these workshops and you don't want to work out and you don't want to do those things because it's a lot of mental stimulation over the course of it. And I found it to be one of the easiest, kind of smoothest workouts that I've had. And that was after a full day of class, knowing we were going into another good day of class. So yeah, for sure. There's little things like that help you if you're paying attention and you're using your intuition to say, hey, this is something good. This is on the right track. Yeah. But in addition, there are real physiological changes that are happening, as we were talking about before. So it's both. It's the mental and the physical coming together and really being able to thrive. And that's really what we're trying to help our patients do. So that's awesome.
Right. And they, and so just like practitioners get to be their own control, so to speak, just like you were with working out and how your body felt and your energy level and the alertness level. And then the other physical therapist who, terrible pain, very, very injured knee, on crutches. And then after the microcurrent and the other stuff that we did, it's like all of a sudden they could walk and it didn't hurt. So this is what we would expect to happen with our patients. And this is what's happened with my patients for nearly a quarter of a century.
Yeah.
Just used to it. And then since 2018, I've been training in the military, and they've been able to reproduce all of the results there. They continue to get funding every year for the research. We're hoping the first paper is going to be out sometime this year. But that first round has come in and they've combined everything also. But they're, that the colonel that was running it at the Air Force Base at the hospital, he's like, oh my gosh, this is the most transformational thing from a medicine standpoint that's happened in the military since I've been here. Wow. So, he is just completely devoted to it. And of course, I got to use this with Wounded Warriors, and I was on the Wounded Warrior medical team and got selected for Invictus. So it's and I teach at Walter Reed every year for the pain initiative for pain care skills. They've had me back every year, 20. So I guess this is my fourth year of doing that. So when you've got these medical doctors, okay, that have access to just about anything they want, and they're like, nope, we're going to do acupuncture, frequency specific microcurrent, and mover stabilizer, because this is what's working feet on the ground for our patients. And they are only interested in how they are taking care of those people and getting them back to work, back to play, back to their jobs and helping with recovery.
Oh, that's fantastic. Amazing. Amazing. So this is great. I mean, I have probably 3 more hours of conversation in me for you, but I know we are reaching the end of our limit here. So can you I know people are going to want to get more information on this, probably, anywhere they might be able to see some research, but then definitely how can they find you and some of the work that you're doing? Give us all that good stuff.
Okay. Well, certainly you can look up frequency specific microcurrent just out of curiosity and look more on that, and read up on some of the papers that are out there. I know, Ryan, I sent you a bunch of the papers. It's not everything right now. A series of papers was just released 2023, January 2023, that is basically doing the deep dive how every single thing in the body is electrical and everything runs off electrical currents at every single level, cells, mitochondria, organelles, and all the communication. And it's a deep dive how important electricity is in the body. And then my training website is frequenciesthatmend.com. So www.frequenciesthatmend, all one word.com. And that is my training site. And then Ryan will tell you that I'm very, very old and I just did not get the social media bug. So I do participate in Facebook. But you will not find me out there everywhere. I would prefer to just have these conversations every week. That would delight me to no end. And like I said, you can go to the training site. And then my email address is shannongoossen@me.com.
Love it. Love it. Well, you are the youngest old person that's out there. So whatever that, you're doing it right. And I just really appreciate the time and you taking out time from your busy day to talk to me about this. And I'm so excited to bring this service to our office. And you're one of the main reasons for that. So thank you. Thank you very much for that.
You're so welcome. Thank you for having me on this show and this podcast, and I appreciate it. And I look forward to us having future conversations.
I do as well. So thank you all for watching. I hope you all have a great rest of your day. Go get some frequency specific microcurrent with your acupuncture. We'll see you soon.